Welcome back, everybody. We are joined by Dr. Timothy Quinn, a family medicine doctor out of Ridgeland, Mississippi. Dr. Quinn, thank you so much for taking time out of your day to be here with us today.
Hey, thank you for having me.
And today we're going to talk about a study that I recently saw in JAMA, and it's pretty eye-opening there. It says anticholinergic, I'll get it out there, drugs and their possible link to a greater risk of dementia. First of all, what are anticholinergic drugs?
Well, basically, these are medications that we prescribe every day, but one of the mechanisms of actions of these medications is they decrease catecholamine in the body. And what this study has shown is they had a significant number, about 285,000 charts that they studied, and these people were 55 or older, and they were all on these medications, and the deal is about greater than 25% had a diagnosis of dementia. Ooh. Now that's a much higher percentage than the general population, which is only 10%. So the conclusion is if you take these medications, there's a higher likelihood that you could develop dementia.
Okay, and we're trying to think what kind of medications would be classified as anticholinergic. What kinds have we heard of out there?
Right. Well, some of these medications include medications for overactive bladder, such as the oxybutynin, some of your depression medications like amitriptyline, even some of the antihistamines like Benadryl have anticholinergic properties. That's why it's so important for studies like this, because what it does is it helps us medical providers to be on the lookout. So if we have a patient that is, 55 or older and starting to develop some dementia, we can do an assessment of their medications, and in the event that they are taking an anticholinergic medication, we can switch to a different medication that doesn't have, this effect on the catecholamines in the body, and then we could actually help the patient. But more importantly, we can also be more aware to make sure every year, as suggested, all of our patients are assessed for dementia, because a lot of patients that have dementia, they don't like to talk about it because there's quite a stigma with it.
Oh, absolutely.
Yeah, and a lot of our senior citizens, they don't want to say, hey, I'm not remembering things, I'm having some depression, and these are all signs of dementia, because it makes them, in a lot of cases, feel that, maybe the end is sooner. And it's just something that's a lot of senior citizens are ashamed of. That's why it's so good for studies like this to raise awareness and also keep us doctors on point so that we can get the information out and assess these patients, and in the event that they are developing dementia, get it diagnosed and treated early. Because it's one of those conditions, if it's diagnosed early and treatment is initiated early, the outcome is so much better.
Yeah, and that's what we want. Yeah, so that is definitely something to keep on track. And sometimes it could be as simple as just switching a medication.
Right, but the deal is with studies like this, now the awareness is greater, especially in the medical community with the medical providers such as myself. Now that's part of the thought process. So like you said, switch the medication, but also go ahead and have the patient assessed properly. Now, there's a program at UMC called the Mind Center at UMC Medical Center in Jackson, Mississippi. They do a very extensive evaluation of all patients that have suspected dementia, and in the event that they are developing dementia, they can get them on the right medication, and as I said earlier, if it's diagnosed early and the medicine is initiated early in the course, the outcome is much more favorable.
Absolutely. Thank you so much, Dr. Quinn, for taking time, and thank you for joining us. We'll be back in just a moment on WJ.